Welcome to the Diverse Minds podcast, where we give you the tips, tools and techniques you need to be a mentally healthy and inclusive leader. Each week, you'll hear about a variety of topics linked to mental health, well-being and diversity that will enhance both your professional practice and personal well-being. Welcome to the show, Asil. We're so delighted to have you with us today.
Thanks, Layla. I'm so happy to be here.
It's brilliant. And, we're in tricky times. So we're going to be talking about public health, COVID-19, race, white privilege, intersectional public health, and the humanitarian perspective. So a lot there. So first of all, could you tell the listeners a bit more about your role now and what you do?
So I work as an advocacy advisor in MSF, in Doctors Without Borders. I'm based in Brussels, which is the headquarters of the organization. And I essentially provide advice and support to the teams on the ground who are developing strategies to either speak out or engage in negotiations and processes to get more care for the patients in the clinics that we have all over the world.
Thanks, Asil. And how did you end up where you are? So what was your leadership journey to your role? And if you want to share any lessons you learned along the way, I think that would be really interesting.
When I was studying Arabic in Yemen, and in the process, I learned a lot from a woman that I worked with at a civil society organization called the Cultural Development Programs Foundation. She had the ear of the president, and she sort of taught me all the different nuances around Yemeni politics and especially women's access to healthcare. So in 2009, I started thinking, well, I'd like to stay in Yemen for a bit longer and keep studying Arabic, but I couldn't really afford it. So I managed to get an internship with this organization, and she saw on my CV that I'd been a librarian, which I'd done when I was growing up in Haringey in North London. And after a while, we got talking and she started putting me on research files. And one of them was to research how internally displaced people in the north of Yemen were being affected by, especially women, were being affected by the conflict with the Houthis. At that time, it was a civil war, unlike the internationalized war that you see today. And so it was really through her mentorship and her guidance that I started growing and gaining confidence and working on my Arabic on the job and still studying. And then I later on, I moved the following year to an organization run by tribal Yemeni men who around conflict and conflict mitigation and using tribal customary law for mitigating conflicts that happen at the kind of local level in Yemen. And I was also involved in research and in programming, and that meant being involved a lot in donor meetings, putting things in proposals, writing things up, translating from Arabic to English, and seeing sort of what makes sense for everybody around the table. And it was then that I got accepted to Oxford, actually. And, I got accepted on the basis of the work that I had been doing with those two organizations and an idea I had around how tribal customary law, which is a sort of informal legal system to resolve conflicts that the state law doesn't resolve. And the program I got accepted into is called, at Oxford, is called International Development Studies. And I thought in that moment, and it was 2011 around then, and the Arab Spring had just been starting, actually. So it was quite a tumultuous period for me. The mentor I'd had passed away. I had to evacuate Yemen because the Arab Spring was becoming very violent. And so I went to the country of my origin, Sudan, which isn't that far from Yemen. I got a flight there, and it's there I got my acceptance from Oxford, and I was sort of jumping up and down, and my family were really excited. And I had been thinking when I applied for that program that the UK was already going in a sort of difficult direction and might need might need the same sorts of analysis and thinking that are often applied to quote unquote developing countries. Those same types of thinking might be needed in the UK. And it was when I got to Oxford, and some people were sort of surprised. They didn't think a girl from Haringey would be at Oxford University. I had people say, "Are you sure you're at Oxford? Are you not at Oxford Brookes? I had one time I was organising an event for the Committee for Racial Awareness and Equality, which is where I'd met you, Layla.
Yeah, absolutely. That's where we met, wasn't it? Because luckily enough, I was accepted into that group to support students. And as you know, I think when we met, I was going through a tough time, and some of it had to be done secretly. But yeah, that is how we met.
So I don't know if I mentioned this to you when we were spending time together at Oxford. I organised a couple of different events which you knew about. One of them was an event for women of African descent. So I wanted to create a kind of support group within the Africa Society umbrella and link that in to the Committee for Racial Awareness and Equality. And so when I was organising one of the events at one of the colleges, I was knocking on the door because I'd booked a room, and one of the students came out and said to me, "It's Saturday, the cleaners are not supposed to be coming in on Saturday."
I didn't know about that, no.
Yeah, I mean, I couldn't really believe it because I just thought, well, it was kind of funny to me because she was an international student, and it was strange to me, having grown up in such a diverse place in Haringey in North London, to suddenly be confronted with a place like Oxford that felt like the sort of belly of colonialism in a way. And it was a really odd thing that all the places I've traveled and lived in, from Lebanon, the conflict zones I've worked in places like Iraq, doing the needs assessment when the migration crisis hit in Europe, or going to working in with sexual and gender-based violence victims in clinics in South Africa, or being in favelas in Brazil, the biggest culture shock I've ever had, I think, was going to Oxford.
Yeah, and I hear that. I mean, obviously I didn't study there, but I do hear that. And I know from a lot of the students I worked with that, interestingly, a lot of African-American PhD students felt exactly the same way.
So then it was, Oxford was a mixed bag of experiences. I mean, intellectually, it was so stimulating. You have access to everything in the library there, every book that's ever been published is at the Bodleian. And we had every week there were, presidents, prime ministers, thought leaders coming to do lectures. You just didn't know what to spend time on. And the kind of weird thing for me was all the ritual at Oxford. As soon as you get in and you're matriculated, your process of starting at Oxford, you're basically told that you are likely to be on the center stage of being one of the world's leaders. And it kind of made me so cognizant and aware of the way that privilege emerges in the UK has so much to do with what people are told is possible for them. So I was sitting in a cafe one day, just next to the Waterstones in the centre of Oxford. And I overheard one of the college professors who was in charge of admissions talking to a school teacher and reviewing with that school teacher, it was, clearly a private school, how all the students were doing. And I slowly started to realize from all the different students I was meeting that many of them had been groomed to go to that university from the beginning. And I just kept thinking it's such a shame that all these incredible resources that are available here are only available to the, are disproportionately available to this select few. And the rituals that we had to engage in, ranging from, toasting in Latin, how you invite mentors to come and have lunches and coffees and 11s and all these terms. I remember getting nervous about which knife and fork do I use. And, half the experience felt like finishing school, like it was preparing you for how to behave in elite circles and elite settings. And it did change, it did sort of pivot the networks that were open to me and the opportunities that were available to me to work. Because after Oxford, I was offered, in the summer between my first and second year, I did an MPhil, a master in philosophy, which is supposed to be the foundation for a PhD, but you can leave with a sort of in-depth master's, if you will, instead of a 1-year MSc. And this was one of the things that had actually attracted me to the program. And the summer between the first and second year, I was struggling to pay the tuition, because as a British student who wasn't international, so I couldn't get access to any of the scholarships for Sudanese or African students, even though there's not like millions of those either. So there was really no support mechanism for me to get that. I couldn't really get a loan that was big enough. So the first year I managed to pull together the tuition through grants and through a lot of help from my dad. But unfortunately, my dad had to give up a lot of his pension fund that he'd built over a long time. So he really invested in me, because I think for him and for that generation generally, it's, seeing their kids be in education and be in the system in the UK, because we'd arrived in the UK as refugees in the early 90s, was his legacy. So that covered part of my first year's tuition. At least I got the rest through grants, but I had to manage the second year, and it was £13,000. So I had met, when I was in Yemen, a consulting company who were who I found really interesting. They did loads of, programmatic work. They did evidence-based research and all these fancy things that I thought were really exciting. And I looked at them when we were in Yemen the year before and thought, wow, I'd really like a job like that, being a consultant and advising on how to do political analysis and how to connect up different groups of people so that they can have a bigger impact. I mean, obviously, little did I know at that time how raw and crude the consulting world could be. But when they heard that I'd gotten into Oxford, suddenly I became an interesting candidate for them. And they offered me a consultancy over the summer, which actually managed to cover the majority of my funding for the second year. They gave me £10,000 to do research, interviews all across Lebanon. They flew me out to Beirut. I'd been in Sana'a doing my research, and they got me to do some workshops while I was there alongside my research and for my MPhil. And then they got me to spend about 6 weeks in driving up and down Lebanon with another Lebanese consultant, interviewing different organizations about the funding that they'd received and where did that funding go, as a kind of monitoring and evaluation exercise. So in Beirut, it was quite a culture shock as well. It had been my first time to Beirut, and that was about 2012. And it's sort of seen as the Paris of the Middle East. And there I had an experience where I was driving in a car to the office, wearing my jacket and my sort of Oxford blue blazer, and feeling very confident and happy, like, wow, I've made it, I've broken in. And then I get in what's called a service, which is a shared taxi. And I'm on my way to the office, and a sort of elderly Lebanese woman gets in the taxi, and the taxi driver says to me in English, "Oh, I'm sorry, I'm going to have to drop this lady off first because she's a bit nearer than you." And I said, I just sort of nodded. I didn't say much. And then she said to him in Arabic, "Oh, don't worry, these maids, they don't mind. You can do anything. They're not going to be bothered." But she used a term in Arabic called abid, meaning these slaves. It doesn't matter what you do. So he sort of circled around, and I think he was a bit annoyed with her. So he actually started driving in the direction of my office and not dropping her off first. And then he started saying to her in Arabic, how can you talk like that? Abid is a very old school term. And that he started saying basically, it's not correct, and that he has a Sudanese friend that he knows. And through interacting with the Sudanese friend, he realized how harmful it is and dehumanizing to use that term. So I get out of the taxi, and in Arabic, I say, thank you so much to the driver. It's been a really eye-opening drive. And he turns around to me in shock and he's saying, you speak Arabic? I said, yes. He said, you understood that whole discussion? He said, yes. Wow. And the woman sort of sat there in shock and in really broken English. She was like, do you understand, Arabic? And then I said, yeah, I'm from Sudan. I grew up in Britain. And then she says to me, oh, so you understand the English? And I just thought, I'm not going to play the same game as you, as like denigrating your language skills, because I also understood that I'm not in the same situation as migrant domestic workers and maids in Lebanon. I have a British passport. I could leave, and I was in a sort of position of relative privilege. And one of the things that my mum taught me, especially that time in Lebanon, she said, don't ever let other people's opinions of you or the way that they perceive you shape how you behave and who you are.
Which is amazing, but it's hard to do, isn't it? As we were talking about before we started recording, that you were talking about how sometimes it doesn't feel, you don't feel, we both of us, we don't feel comfortable in certain spaces for a reason.
No, that's very true, because I think my whole career that followed after that, because after I left Oxford, I then started working full time for the consultancy in Beirut. And because I'd spent most of that summer working, I didn't actually have as much time as I wanted to do my research properly. So I'd been accepted onto the PhD at Oxford. And because I'd been, sort of working, I didn't get the distinction I needed in my dissertation to fulfill the requirements to take my place in the PhD. And I was so devastated because I'd really wanted this sort of career as a professor. But at the same time, it turned out to be the best thing that happened to me, because I was really uncomfortable a lot of the time at Oxford. As much as I was intellectually stimulated, I made some of my best friends there. The years that followed, where I spent 5 years in Beirut, firstly working for this consulting firm, and then later on being an independent consultant and eventually joining MSF. When I was at the consultancy, I worked a lot with people from various government ministries, ranging from the UK to, Denmark, and to the ministries themselves in Yemen. And at 26, I was the sort of country manager in Yemen. And I remember saying to an old friend at Oxford, I think she's Nigerian, she's at the World Bank now, and I said to her, I can't believe I'm 26 and I'm a country manager. Like, isn't that ridiculous? And she said to me, well, white people are doing that all the time. Why, don't worry about it. And it created a real inner conflict and tension inside me, because I started thinking about how, is it okay to use the same measures of success that have been actually quite harmful measures of success, like having young, unqualified people managing entire offices just because they're privileged and they have access to networks and they can. Is that really the way that I want to live my life? And at the same time, I constantly found myself moving between these different spaces. 1 week I'd be in, briefing in the Ministry of Defence or the Foreign Commonwealth Office. The next week I'd be in Istanbul talking to, people who were managing the response efforts in Syria, because at that time the Arab Spring basically became, civil wars and internationalized civil wars later on. And one of the major front lines on the fight against the counter-terror wars, for lack of a better phrase, meaning wars that are fueled and financed as a way to protect Britain more than they are to protect the people who are on the front lines of facing it.
Yeah, we know that because more Muslims die if we think about, the Western rhetoric about Islamist terrorism, more Muslims die at the hands of terrorism than non-Muslims.
Yeah, exactly. And that's the exact same thing I found in Yemen. So I had this really tricky situation where at the consultancy, we were, in touch with British government donors. And at the same time, we were in touch with a network of civil society organizations in Yemen who were telling us about how they were facing the consequences themselves of acts of terror in the country. And the challenging thing was how to channel the aid that was there primarily to protect Britain, and sort of feeling like in the ministry spaces that I was in the middle of this good Muslim, bad Muslim, us versus them narrative, and never really knowing which side of the narrative I was supposed to fit on, because neither of them really satisfied me. I felt kind of constantly trapped between two patriarchies, a patriarchy that I saw, rife in the Middle East. And with my Arab and Muslim interlocutors, I would often, resist some of the attitudes around what a woman's place should be. And on the other hand, a kind of dark characterization of the Muslim in the British mind, which ignored the ways in which patriarchy and authoritarianism played out in the UK. I mean, the UK had used at that time measures in legislation to essentially curtail the rights of anyone in the UK if they were just suspected of being a terrorist. And when I later on moved to work at MSF, the main concern was that a human is a human and everybody has right to access to healthcare. You could be a terrorist to one person and a freedom fighter to a totally different person.
And so did you want to talk a little bit about, so I know that you wanted to talk about pandemics, how they have been managed or not managed particularly well, and also through the lens of intercultural perspectives, and, how it could have been done better.
Well, I think for me, the main thing is I was in the UK a couple of weeks ago, just the day before Tedros from the WHO announced that that COVID-19 was a global pandemic. And we had been watching from Brussels, where I've since moved, the alarming rate at which the cases have been rising. The UK government's approach skipped the first phase that you need in an epidemic. And the few weeks before, I'd been reading over the Ebola response and the measles response in 2019 in Congo. And, realizing when I got to London that most people would not be familiar with or know how to respond to an epidemic because they're just not used to it. So I was in a hurry trying to cancel all the meetings I had, especially in town with friends, all the coffee dates and things like that. And people... In the beginning, some of my friends found me alarmist. And I found it quite interesting that the friends that found me alarmist were mostly the friends that I had gone to Oxford with. And they were saying things to me, misinformation, things like babies don't get it. And I had to explain to them, it's not really about whether babies do or don't get it. They can get it.
Yeah.
It's the fact that, do you want to be out of commission for at least a month and not able to look after your baby? And then I realized, well, actually, those that will be affected by the virus, if they can afford childcare, if they can afford to work from home, if they can afford to continue to live even with the lockdown measures, the virus isn't as scary for them as it is for the growing number of undocumented people and homeless people in the UK. And the NHS's incapacity to respond. I think the NHS is doing an incredible job. So many brave workers are going back into work. But the question for me is, should they have to? The stimulus package that the government put out 2 weeks ago primarily targeted businesses. I think that they didn't want to do all of the lockdown and movement restrictions that they would have, had to do much earlier than they're trying to do them right now. If they had done it sooner in a post-Brexit economy, I would imagine that they were looking at Italy and seeing the consequences on the economy and trying to save the economy first. But my question is, who does that save? Who does focusing on continuing travel and aid and the Eurostar, who does that really sort of protect? And the measures in the healthcare centres that are being put in place are important, but the real measures that sort of need to be in place are the ones that would help the most vulnerable access healthcare. If you can't leave your house, there are many other things that will happen to you, even if you don't get the virus. You can have couples that are forced to be in isolation with somebody who beats them. You could be living in a densely populated area that already doesn't have a lot of access to healthcare, like some of the places that I grew up in North London. And you might also find that, the solidarity that's being called for at the moment, which I think is really beautiful, is a real sign that thinking about others and others' needs and the broader society is something that's been needed in the UK for a long time, because the failure to respond to this epidemic isn't just about how scary the virus is, which is, I think, the way the government is trying to spin it. It's got a lot more to do with how unprepared and how vulnerable the government left its population and the citizens.
Completely. And I think we're seeing that, aren't we? So I've seen some really interesting posts around, isn't it interesting that people are saying socialism is this, that, the other, when actually when something like this happens, you realize the most valuable thing are your hospitals, your schools, public services, and nothing else really matters, actually. And how people's well-being is put under a microscope, even if you're quite well. I spoke to someone this morning who said, my usual coping strategies aren't working and I don't know what to do. And actually, I've got very good coping strategies and I'm in a stable job. And what about other people who are in a less fortunate situation?
This is exactly it, Layla. The thing is, I think one of the consequences of being privileged or of white privilege is that people don't think it will ever happen to them. They kind of think that epidemics and these sorts of problems are reserved for Africa and for other places.
The whole continent as well. I think that's a really important point. And I'm very conscious when I talk about specific countries in Africa, and then I'll say the whole continent of Africa, because people do that broad brushstroke, don't they? It's like you go, from Egypt to, there's that famous bike race, Cairo to Cape Town. And if you think about not just the distance, but the different cultures and trajectories that you move through, it's one continent, not one country. So I just, that's one of my big things.
I completely agree with you, and I think that this idea of privilege blinds people to the idea that that their freedoms and liberties would have to be curtailed, in a minor way to help stop the epidemic spread. And now, what's even more worrying is the government has passed through legislation that curtails people's freedoms in a way that has become unacceptable. Where you can tap into people's phones to make sure that they don't break quarantine. These authoritarian measures wouldn't have been necessary if they'd taken it seriously from the beginning and protected people and also protected health workers by making sure that there were enough staff. That it isn't a coincidence that this pandemic is happening now in the UK. And UK is one of the, it's one of the worst hit at the moment. People are hearing about the pandemic all over the world, but the way that the numbers are skyrocketing in the UK leaves them easily in the top 10 most affected at the moment. And other indicators that have been coming out of the UK for the last couple of years, like last year, the Child Rights Index put the UK even lower than Sudan.
Yeah, I know. I saw that, and it is interesting because if you look at historically, particularly West African countries like Sudan as well and Mali, they were and Angola. They were the centres in the 1614 to 1600s of civilization and wealth, and how people don't know this, and if they do, they don't remember it, and how it's seen as the West is best.
Exactly. So I think that one of the key challenges is going to be, and continues to be, that if the attitude is West is best, then people will continue to be blind to the fact that there are so many homeless people in the UK that won't be able to self-isolate, that won't be able to do quarantine, that there will be single mothers who won't be able to work if their kids aren't going to school. And there'll be all these other protection mechanisms that we had in place before under previous governments to help people cope with pressures such as childcare that have been stripped away as a result of the current government, won't be in place to support the people that are actually needed for the economy. And now the people that are most necessary are the Deliveroo and Uber Eats people, the taxi drivers, the garbage collectors, the health workers, the
shelf stackers,
all these people, shopkeepers, all the people that are the most underpaid in the country, which shows exactly how disproportionate the value that's placed on different people and who is seen as necessary for something. But I've been seeing a lot of inspiring initiatives in other places, in South Africa, in Brazil. We've been getting news from our teams that people in favelas in Brazil are kind of organizing how to do hand sanitization without the use of sanitizer. But the fact that the UK hasn't, and other European countries haven't actually managed the pandemic well and have allowed people to travel abroad and export cases has left other countries who already have difficulties in access to healthcare as well, in a very compromising situation. And there's not enough, I think, being said about that in the press, as well as not enough really being said about the fact that the UK isn't in a stronger position to manage something like this, and will have to adapt to a new normal now.
Yeah, no, you're absolutely right. There is going to be a new normal. I don't think things will go back to how they were. And maybe that's a good thing. But also in your eyes, what do you think are the 3 things that the humanitarian / development sector could do to improve cultural awareness, inclusivity in a genuine way?
That's a really good question. I think that the first thing is that a lot of humanitarian work in the past was based on the sort of white savior complex, the idea that you go abroad and that needs are very far away and you go and rescue people from themselves. So I think promoting humanitarianism as an act of solidarity, of the possibility of being in connection and in relationship to other people rather than being there to simply rescue them, is one way of attracting a different type of humanitarian worker. And I think we do have quite a lot of those types of humanitarian workers in the organisation I work for. But you still get your odd person who's more focused on their own reputation and how the work affects them. And I think another way that I've explored and discussed with some of the people I work with is that it's not just rich people that want to give and to donate as well to organizations. Sometimes you can encourage accountability when people from the very communities that you're going to serve alongside of, if they give to the humanitarian sector, it can also bring about a kind of accountability when you fundraise as well amongst poorer communities, because people don't like to be in the position of needing, they also want to be in the position of helping. And the other way is designing every project in consultation with the people who are being affected. It doesn't mean that you stop having expertise. You need to still have expertise and solid programs and services that you're trying to provide. But it's a question of how you provide them, who has access to it, and where. That needs to happen in a sort of conversation and in a kind of network.
Thank you. Those are really practical things that clearly don't cost money, but they do take a bit of thought. And I hope that if any people who work in humanitarian sector are listening, that you will take those on board, because I think they're super, super important. And then Asil, finally, just before we finish, I wanted to ask you how you look after your mental health in the face of microaggressions and some of the racism that we've talked about, that you've experienced, the commonalities that we've had as well. But how do you look after your mental health, and what are your tips for other people?
I think mental health is always a struggle, but I think it starts with how you define mental health for yourself. There's a lot out there around self-care, and some of it is stuff that I don't find very useful. Like, people think that self-care is having a bath and taking time off. And these are things that, A, you can't always afford to do, and B, aren't actually what's necessarily going to help you in that moment. For me, self-care is the opportunity of living as myself. That's how I define it. And in a way where I can protect my values. And so the first act of self-care for me is working in an industry and in a job that I'm passionate about, that I feel is meaningful and I believe in, regardless of what other people think. So if you do take time out in the mornings or in the evenings, or you do decide to do these baths or walks or things that are there, I think that time is preserved for reminding yourself of why you're doing things. So that you can create a space for yourself that's sort of outside the noise that you hear around you. That's obviously not always going to be easy. You still have to confront other people and be confronted by people's, negative perceptions of you, or if there's days when you wear your hair out and people start making comments about your hair. Or if you have moments when you don't speak formal English, or you don't write something in the perfect way. I think positive self-talk is really important. So allowing yourself to say, I'm here, I'm in the conversation, and this is what matters, is really key. The other thing for self-care is forming allies and partnerships, and they don't always have to be with Black people. They don't always have to be with people of color, because sometimes, because of the institutional structures and global structures, those can sometimes also be spaces of enmity. I remember when I was working in South Africa, it was really fascinating working on a gender-based violence project. And in a country where so many Black women are, leaders in their communities and were represented in the Ministry of Health and things like that. But there was also a lot of those microaggressions that they experienced started to come out in their behavior towards other people. So I think self-care is also trying to see beyond if another Black person is being aggressive towards you, choosing to be, when you can, loving towards them, and hoping that they'll do the same if you have an off day. So cutting yourself some slack and cutting other people some slack is really important. And then, organizing ahead for meetings. So if you've got a big meeting coming up where you want to pass very big messages or key messages, it's really important to have those allies that you discuss what you want to share in that meeting with, and have them reinforce your message in the meeting. To say, for example, let's say me and you are going to a meeting next week, and we know there's going to be lots of senior, white male managers there, for example. We can brainstorm together on Monday morning or Sunday night and say, okay, I want to say this and you want to say this. And when you say something, it's really important that I'm not talking or whispering to someone else or emailing or texting. I've got to show that I pay attention and that I respect you. And then if you say something, I should say, as Layla said. And then when it comes to the minutes of that meeting, making sure that you know who's writing the minutes and that you try to influence what's written in the minutes of that meeting, and that you think about distribution of labor. Sometimes we want to do everything ourselves because we have grown up thinking that we have to be perfect to be accepted, and we've had to work sometimes twice as hard as other people to get, half the pay and even a more junior position. So trying to make sure that I allow, as I got more senior in my work, allowing, the assistant to write the minutes of the meeting, allowing other people to help you with your workload. And also, if you're in a meeting with somebody who is, likely to take credit for the work that you're doing. I see that a lot. There's often white men not doing as much of the work, trying to be author or co-author on other people's ideas, often women's ideas. If they want to do something like that, use them as a resource instead of them using you as a resource all the time. So if you're, saying loads of things in a meeting, and then you notice that somebody then comes out with an article saying exactly the things that you've said in that meeting, then try to create a partnership with those people, so that maybe, yes, you do co-author, but you get them to do all the work. You get them to use their networks and their visibility as a way to promote yourself and your voice. Because at the end of the day, what I think this pandemic also shows is that the exploitative mechanisms that have existed in the world for centuries now, they need the people that they exploit in order to exist. So knowing that your value is you being there, you showing up, and you being well, is often a motivating factor that at the very least helps me get out of bed in the morning.
Yeah, no, you're so right. Thank you, Asil. It's been such an enlightening conversation, and thank you for being so bold and open about your lived experience. And we met many years ago, but I'm glad we've managed to keep in touch. And you've been a guest on the show today. And if people want to connect with you and know more about your work, how should they do that?
I think probably the best thing is Twitter. My Twitter handle,
okay, yep.
Asil Sidahmed.
Okay, brilliant. And I'll share that on the show notes as well. And I just want to thank you again, and to stay safe and keep well. And we really appreciate your time and your knowledge that you've shared with us today.
Okay, thank you so much, Layla. Bye.
Bye.
Thanks for listening to the Diverse Minds podcast. Don't forget to subscribe on Apple Podcasts, Spotify, or wherever you access your podcasts from. You can also connect with me on Facebook, Twitter, and LinkedIn. Tune into next week's episode of the podcast, where I'll bring you more insights on mental health and inclusion. Bye for now.